Okay, so for wrist flexion, the range is 0 to 80, and the muscles involved are the flexor carpi radialis, the flexor carpi ulnaris, and the palmaris longus. For wrist extension, the normal range is 0 to 70, and the muscles involved are the extensor carpi ulnaris, the extensor carpi radialis longus, and the extensor carpi radialis brevis. And then for radial deviation, the normal range is 0 to 45, and the muscles involved are the flexor carpi radialis, the extensor carpi radialis longus, and the extensor carpi radialis brevis. And then ulnar deviation is the normal range is 0 to 35, and the muscles involved are the flexor carpi ulnaris and the extensor carpi ulnaris. So the flexor carpi radialis, the origin is the common flexor tendon of the medial epicondyle, and the insertion is the base of the second and third metacarpals. And then flexor carpi ulnaris, the origin of the humeral head is the common flexor tendon of the medial epicondyle, and the origin of the ulnar head is the posterior surface of proximal 2/3 of the ulna. And then the insertion is the pistiform hook of the hamate base of the fifth metacarpal. And then the palmaris longus, the origin is the common flexor tendon of the medial epicondyle. And the insertion is the flexor retinaculum and palmar aponeurosis. And then extensor carpi ulnaris, the origin is the common flexor tendon of the lateral epicondyle, and the insertion is the base of the fifth metacarpal. And then the extensor carpi radialis longus, the origin is the distal 1/3 of the lateral supracondylar ridge of the humerus, and the insertion is the base of the second metacarpal. And the extensor carpi radialis brevis, the origin is the common extensor tendon of the lateral epicondyle. Common extensor tendon of the lateral epicondyle, and the insertion is the base of the third metacarpal.